51. Because diet and exercise have failed to control a 63-year-old client's blood glucose level, the client is prescribed glipizide glucotrol. After oral administration, the onset of action is A. 15 to 30 minutes, B. 30 to 60 minutes, C. 1 to 1.5 hours, D. 2 to 3 hours.
Answer: a glipizide begins to act in 15 to 30 minutes. The other options are incorrect.
Question 52. A client with pneumonia is receiving supplemental oxygen, 2 liters per minute via nasal cannula. The client's history includes chronic obstructive pulmonary disease (COPD) and coronary artery disease. Because of these findings, the nurse closely monitors the oxygen flow and the client's respiratory status. Which complication may arise if the client receives a high oxygen concentration? A. Apnea, B. Anginal pain, C. Respiratory alkalosis, D. Metabolic acidosis.
Answer: a hypoxia is the main breathing stimulus for a client with COPD. Excessive oxygen administration may lead to apnea by removing that stimulus. Anginal pain results from a reduced myocardial oxygen supply. A client with COPD may have anginal pain from generalized vasoconstriction secondary to hypoxia. However, administering oxygen at any concentration dilates blood vessels, easing anginal pain. Respiratory alkalosis results from alveolar hyperventilation, not excessive oxygen administration. In a client with COPD, high oxygen concentrations decrease the ventilatory drive, leading to respiratory acidosis, not alkalosis. High oxygen concentrations don't cause metabolic acidosis.
Question 53. A client with type 1 diabetes mellitus has been on a regimen of multiple daily injection therapy. He's being converted to continuous subcutaneous insulin therapy. While teaching the client about continuous subcutaneous insulin therapy, the nurse would be accurate in telling him the regimen includes the use of A. Intermediate and long-acting insulins, B. Short and long-acting insulins, C. Short-acting only, D. Short and intermediate-acting insulins.
Answer: C. Continuous subcutaneous insulin regimen uses a basal rate and boluses of short-acting insulin. Multiple daily injection therapy uses a combination of short-acting and intermediate or long-acting insulins.
Question 54. A client who recently had a cerebrovascular accident requires a cane to ambulate. When teaching about cane use, the rationale for holding a cane on the uninvolved side is to A. Prevent leaning, B. Distribute weight away from the involved side, C. Maintain stride length, D. Prevent edema.
Answer: B. Holding a cane on the uninvolved side distributes weight away from the involved side. Holding the cane close to the body prevents leaning. Use of a cane won't maintain stride length or prevent edema.
Question 55. A client with a history of an anterior wall myocardial infarction is being transferred from the coronary care unit (CCU) to the cardiac step-down unit (CSU). While giving report to the CSU nurse, the CCU nurse says, his pulmonary artery wedge pressures have been in the high normal range. The CSU nurse should be especially observant for A. Hypertension, B. High urine output, C. Dry mucous membranes, D. Pulmonary crackles.
Answer: D. High pulmonary artery wedge pressures are diagnostic for left-sided heart failure. With left-sided heart failure, pulmonary edema can develop, causing pulmonary crackles. In left-sided heart failure, hypertension may result and urine output will decline. Dry mucous membranes aren't directly associated with elevated pulmonary artery wedge pressures.
Question 56. The nurse is caring for a client with a fractured hip. The client is combative, confused, and trying to get out of bed. The nurse should A. Leave the client and get help. B. Obtain a physician's order to restrain the client. C. Read the facility's policy on restraints. D. Order soft restraints from the storeroom.
Answer: B. It's mandatory in most settings to have a physician's order before restraining a client. A client should never be left alone while the nurse summons assistance. All staff members require annual instruction on the use of restraints, and the nurse should be familiar with the facility's policy.
Question 57. For the first 72 hours after thyroidectomy surgery, the nurse would assess the client for Kvostnik's sign and Trousseau sign because they indicate which of the following? A. Hypocalcemia. B. Hypercalcemia. C. Hypokalemia. D. Hyperkalemia.
Answer: the client who has undergone a thyroidectomy is at risk for developing hypocalcemia from inadvertent removal or damage to the parathyroid gland. The client with hypocalcemia will exhibit a positive Kvostnik's sign facial muscle contraction when the facial nerve in front of the ear is tapped, and a positive Trousseau's sign carpal spasm when a blood pressure cuff is inflated for few minutes. These signs aren't present with hypercalcemia, hypokalemia, or hyperkalemia.
Question 58. In a client with enteritis and frequent diarrhea, the nurse should anticipate an acid-base imbalance of A. Respiratory acidosis. B. Respiratory alkalosis. C. Metabolic acidosis. D. Metabolic alkalosis.
Answer: C. Diarrhea causes a bicarbonate deficit. With loss of the relative alkalinity of the lower GI tract, the relative acidity of the upper GI tract predominates, leading to metabolic acidosis. Diarrhea doesn't lead to respiratory acid-base imbalances, such as respiratory acidosis and respiratory alkalosis. Loss of acid, which occurs with severe vomiting, may lead to metabolic alkalosis.
Question 59. When caring for a client with a nursing diagnosis impaired swallowing related to neuromuscular impairment, the nurse should A. Position the client in a supine position. B. Elevate the head of the bed 90 degrees during meals. C. Encourage the client to remove dentures. D. Encourage thin liquids for dietary intake.
Answer: B. The head of the bed must be elevated while the client is eating. The client should be placed in a recumbent position, not a supine position, when lying down to reduce the risk of aspiration. Encourage the client to wear properly fitted dentures to enhance his chewing ability. Thickened liquids, not thin liquids, decrease aspiration risk.
Question 60. A nurse is caring for a client who has a tracheostomy and temperature of 39 C. Which intervention will most likely lower the client's arterial blood oxygen saturation? A. Endotracheal suctioning. B. Encouragement of coughing. C. Use of cooling blanket. D. Incentive spirometry.
Answer: endotracheal suctioning secretions as well as gases from the airway and lowers the arterial oxygen saturation SO2 level. coughing and incentive spirometry improve oxygenation and should raise or maintain oxygen saturation. Because of superficial vasoconstriction, using a cooling blanket can lower peripheral oxygen saturation readings, but SO2 levels wouldn't be affected.
Question 61. A client with a solar burn of the chest, back, face, and arms is seen in urgent care. The nurse's primary concern should be A. Fluid resuscitation, B. Infection, C. Body image, D. Pain management.
Answer: D. With a superficial partial thickness burn such as a solar burn sunburn, the nurse's main concern is pain management. Fluid resuscitation and infection become concerns if the burn extends to the dermal and subcutaneous skin layers. Body image disturbance is a concern that has a lower priority than pain management.
Question 62. Which statement is true about crackles? A. They're grating sounds. B. They're high-pitched, musical squeaks. C. They're low-pitched noises that sound like snoring. D. They may be fine, medium, or coarse.
Answer: D. Crackles result from air moving through airways that contain fluid. Heard during inspiration and expiration, crackles are discrete sounds that vary in pitch and intensity. They're classified as fine, medium, or coarse. Pleural friction rubs have a distinctive grating sound. As the name indicates, these breath sounds result when inflamed pleurae rub together. Continuous, high-pitched, musical squeaks, called wheezes, result when air moves rapidly through airways narrowed by asthma or infection, or when an airway is partially obstructed by a tumor or foreign body. Wheezes, like gurgles, occur on expiration and sometimes on inspiration. Loud, coarse, low-pitched sounds resembling snoring are called gurgles. These sounds develop when thick secretions partially obstruct airflow through the large upper airways.
Question 63. A woman whose husband was recently diagnosed with active pulmonary tuberculosis (TB) is a tuberculin skin test converter. Management of her care would include A. Scheduling her for annual tuberculin skin testing. B. Placing her in quarantine until sputum cultures are negative. C. Gathering a list of persons with whom she has had recent contact. D. Advising her to begin prophylactic therapy with isoniazid INH.
Answer: D. Individuals who are tuberculin skin test converters should begin a 6-month regimen of an antitubercular drug such as INH, and they should never have another skin test. After an individual has a positive tuberculin skin test, subsequent skin tests will cause severe skin reactions but won't provide new information about the client's TB status. The client doesn't have active TB, so can't transmit or spread the bacteria. Therefore, she shouldn't be quarantined or asked for information about recent contacts.
Question 64. The nurse is caring for a client who had an above-the-knee amputation. The client refuses to look at the stump. When the nurse attempts to speak with the client about his surgery, he tells the nurse that he doesn't wish to discuss it. The client also refuses to have his family visit. The nursing diagnosis that best describes the client's problem is A. Hopelessness. B. Powerlessness. C. Disturbed body image. D. Fear.
Answer: C. Disturbed body image is a negative perception of the self that makes healthful functioning more difficult. The defining characteristics for this nursing diagnosis include undergoing a change in body structure or function, hiding or overexposing a body part, not looking at a body part, and responding verbally or non-verbally to the actual or perceived change in structure or function. This client may have any of the other diagnoses, but the signs and symptoms described in the case most closely match the defining characteristics for disturbed body image.
Question 65. A client with 3 children who is still in the childbearing years is admitted for surgical repair of a prolapsed bladder. The nurse would find that the client understood the surgeon's preoperative teaching when the client states, A. If I should become pregnant again, the child would be delivered by cesarean delivery. B. If I have another child, the procedure may need to be repeated. C. This surgery may render me incapable of conceiving another child. D. This procedure is accomplished in 2 separate surgeries.
Answer: B. Because the pregnant uterus exerts a lot of pressure on the urinary bladder, the bladder repair may need to be repeated. These clients don't necessarily have to have a cesarean delivery if they become pregnant, and this procedure doesn't render them sterile. This procedure is completed in 1 surgery.
Question 66. A client experiences problems in body temperature regulation associated with a skin impairment. Which gland is most likely involved? A. Eccrine. B. Sebaceous. C. Apocrine. D. Endocrine.
Answer: the eccrine glands are associated with body temperature regulation. Sebaceous glands lubricate the skin and hairs, and apocrine glands are involved in bacterial decomposition. Endocrine glands secrete hormones responsible for the regulation of body processes, such as metabolism and glucose regulation.
Question 67. A school cafeteria worker comes to the physician's office complaining of severe scalp itching. On inspection, the nurse finds nail marks on the scalp and small light-colored round specks attached to the hair shafts close to the scalp. These findings suggest that the client suffers from A. Scabies, B. head lice, C. tinea cupitis, D. impetigo.
Answer: B. The light-colored spots attached to the hair shafts are nits, which are the eggs of head lice. They can't be brushed off the hair shaft like dandruff. Scabies is a contagious dermatitis caused by the itch mite, Sarcoptes scabiei, which lives just beneath the skin. Tinea cupitis, or ringworm, causes patchy hair loss and circular lesions with healing centers. Impetigo is an infection caused by Staphylococcus or Streptococcus, manifested by vesicles or pustules that form a thick, honey-colored crust.
Question 68. Following a small bowel resection, a client develops fever and anemia. The surface surrounding the surgical wound is warm to touch and necrotizing fasciitis is suspected. Another manifestation that would most suggest necrotizing fasciitis is A. erythema, B. leukocytosis, C. pressure like pain, D. swelling.
Answer: C. Severe pressure like pain out of proportion to visible signs distinguishes necrotizing fasciitis from cellulitis. Erythema, leukocytosis, and swelling are present in both cellulitis and necrotizing fasciitis.
Question 69. A 28-year-old nurse has complaints of itching and a rash of both hands. Contact dermatitis is initially suspected. The diagnosis is confirmed if the rash appears. A. erythematous with raised papules, B. Dry and scaly with flaking skin. C. Inflamed with weeping and crusting lesions. D. Excoriated with multiple fissures.
Answer. A contact dermatitis is caused by exposure to a physical or chemical allergen, such as cleaning products, skin care products, and latex gloves. Initial symptoms of itching, erythema, and raised papules occur at the site of the exposure and can begin within 1 hour of exposure. Allergic reactions tend to be red and not scaly or flaky. Weeping, crusting lesions are also uncommon unless the reaction is quite severe or has been present for a long time. Excoriation is more common in skin disorders associated with a moist environment.
Question 70. When assessing a client with partial thickness burns over 60% of the body, which of the following should the nurse report immediately? A. Complaints of intense thirst. B. Moderate to severe pain. C. Urine output of 70 milliliters the first hour. D. Hoarseness of the voice.
Answer. D. Hoarseness indicate injury to the respiratory system and could indicate the need for immediate intubation. Thirst following burns is expected because of the massive fluid shifts and resultant loss leading to dehydration. Pain, either severe or moderate, is expected with a burn injury. The client's output is adequate.